we can see the renal mass using ultrasound is a common situation. Ultrasound is an accessible, cost-effective, and non-invasive image modality. However, we may have a difficult situation to divide renal cell carcinoma and angiomyolipoma in a small mass. Most RCC are hypoechoic finding on ultrasound. However, about 30% of small RCC appear hyperechoic, similar to small AMLs. And the instance of atypical isohypoechoic and slightly hyperechoic AMLs account for 6 to 29% of small renal mass. So the usefulness of ultrasound is limited for small renal mass in some situations. Especially the patient with uncharacterized small renal mass have to get a further imaging study, such as contrast-enhanced CT scan or MRI. However, its sensitivity and specificity for the RCC are about 80 to 90%. And we have to consider nephrotoxicity of a contrast media, radiation hazard, and high cost. Recently, we can see a contrast-enhanced ultrasound, CEUS, because of development of new contrast media and imaging techniques. We can see the continuous micro and macro circulation of a renal mass using a CEUS. I think it's so useful for the diagnosis of renal mass. And ultrasound contrast agent is relatively harmless with a low incidence side effect and lower nephrotoxicity. So we try to determine that CEUS could improve the diagnostic accuracy of ultrasound for the small renal mass or not. Where Dr. O, he's going to introduce multi-rand method and result of this study.
Between January 2011 and December 2013, 85 consecutive patients underwent contrast-enhanced ultrasound after being diagnosed with a renal masses that was first detected by the baseline in the ultrasound. Among the patients, 49 with solid renal tumors with a diameter of 4 centimeters and under were included in the study. The remaining 36 patients were excluded because of complicated renal cyst. The final diagnoses were confirmed by histopathological examination as RCC cases 38 and AML cases 11. A hypochogenic mass with a diameter of 3.0 centimeters was located in the hilum area of the right kidney. Right side of the image is a contrast-enhanced ultrasound image at the arterial phase. It will show that the diffuse heterogeneous enhanced the renal tumor. A hypochogenic mass with a diameter of 2.8 centimeters was located in the right lower pole kidney. Contrast-enhanced ultrasound imaging at the late phase showed that the tumor was washed out. A hypochogenic mass with a diameter of 3.8 centimeters was located in the left lower pole kidney. Contrast-enhanced ultrasound imaging at the late phase showed perilesional enhancement with a slow centripetal fill in a rim-like pattern. Conventional ultrasound demonstrated that the renal mass with a diameter of 2.3 centimeters was located in the right upper pole kidney. Contrast-enhanced ultrasound imaging showed a dot-like enhancement as a hypoenhancing lesion with a progressive hypoenhancement in the late phase. The echogenicity of renal tumors observed in conventional ultrasound was similar to the other study, but approximately 39.5% of small RCCs were hypoechoic in our study. We compare the differences of contrast-enhanced ultrasound finding between clear cell carcinoma and papillary carcinoma. Statistical analysis using a small number of papillary carcinoma patients was difficult, but both groups have similar characteristics of the contrast-enhanced ultrasound findings. The features of diffuse heterogeneous enhancement, washout, and perilesional rim-like enhancement achieve significant differences between RCCs and AMLs. The sensitivity, specificity, positive predictive value, negative predictive value, and accuracy for RCC was 86.8%, 63.6%, 89.2%, 58.3%, and 81.6%.
Well, our results suggest that CEUS, contrast-enhanced ultrasound, allows confirmation of RCC, distinguishing from AML in a small renal mass. It shows diffuse heterogeneous enhancement, washout in the late phase, and perilesional limb-like enhancement. So it can improve the diagnostic accuracy of conventional ultrasound. It may also decrease the use of additional diagnostic studies. Thank you for your attention.